Hi, today we are going to be administering medications. The first medication that we're going to administer is going to be via subcutaneous injection, and it's going to be heparin. Heparin is a high alert medication. It is an anticoagulant, that is the class. It is used to prevent the formation of clots, and for clots that have already formed, it prevents them from getting any bigger, but it does not destroy clots. It works by accelerating the formation of antithrombin, which prevents the growth and kind of deactivates thrombin. The side effects would be fever, hemorrhage. That's one of the most severe, one of the things that we look out for. We're going to look out for, and we'll tell the patient to look out for bruising, bleeding, nosebleeds, any blood in their urine, any blood in their stools, tarry stools. They may, with subcutaneous injections, you may have subcutaneous necrosis. Some of the side effects that the patient may encounter: mild pain, chills, and if they are getting this over long term, they may develop osteoporosis. We need to ask the patient if they have any allergies, if they are allergic to heparin, of course, but we also need to ask them if they are allergic to beef or pork, because heparin is made from pig intestines and lungs of cattle. So if they have any of those allergies, we need to be aware of that. We also need to tell them that they need to, as far as their diet, they need to avoid foods that are high in vitamin K, such as green leafy vegetables, broccoli, Brussels sprouts. They do not need to smoke, and if they are going to start any type of herbal therapy, they need to check with their doctor first to make sure that it's not going to interfere with the effects of heparin. It's contraindicated in patients who have active bleeding, any ulcerative lesions of the GI tract. It's conditionally contraindicated in patients that have an NG tube or any tube that provides continuous suction from the stomach or the intestines. Patients that may have subacute bacterial endocarditis, severe hypertension, and shock. Contingencies for this medication: I would need to check the labs, which on this patient I have done so. I've checked the INR, the PTT, and the platelet count. The PTT was low, which means that we are good to give this medication. The low PTT indicates that the patient has a shorter clotting time. Their blood is clotting sooner than it should, so we do need to administer the anticoagulant. For this administration, the sub-Q, the onset is going to be 20 to 60 minutes. The peak will be 2 to 4 hours, and the duration is variable. Okay, now the other medication that we're going to be administering is morphine. We're going to be administering this through IV push and through an INT. Morphine is in the class of opioid analgesics. It's a Schedule II controlled substance. It's used to treat moderate to severe pain. It works by attaching to the opiate receptors in the central nervous system and binding to them so that to alter the patient's perception of the pain and their emotional response to the pain. Side effects: some of the most severe side effects that we really need to look out for is respiratory depression, respiratory arrest, cardiac arrest. Some of the more minor complications that the patient can and may experience are constipation if they are taking it over a long period of time. They may have pruritus and an itching feeling on their skin, urine retention, diaphoresis, And effects on labs. It may, morphine may actually decrease their platelet counts. So that could be something to note. Patient teachings. We need to let the patient know that if they experience any problems breathing, they need to let us know immediately. If they are going to get out of bed, they need to use caution because they may be a little unstable on their feet, or if they're going to be walking. And if caregivers who are with the patient, we need to let them know, caregivers or family members, to look out for problems breathing, excessive sleepiness, or if the patient becomes unresponsive, they need to let us know immediately. It's contraindicated in patients who are currently taking a central nervous system depressant, such as benzodiazepines or alcohol. Typically, those two medications are not given together, the benzodiazepines and morphine, due to they both affect the central nervous system and can decrease respiration. The only time that if other therapies have proved to be inadequate, then they would closely monitor patients who are taking that combination. And it is also contraindicated in patients with a GI obstruction. Contingencies on this medication would be to monitor vital signs, especially the respiration rate. If it were less than 10, then we would not administer the medication. And let's see, and then we would also notify the appropriate person. For the IV push method of administration, onset is rapid, within 5 minutes. The peak is 20 to 60 minutes, and the duration is 4 to 5 hours. Okay, so that's our medications. So the first thing that I'm going to do is I'm going to compare our MAR with our doctor's orders. Going to make sure that we have the right patient. And we do. We have Billy Bob. The start date for the order, we have that. The time for the order. And the medication. Our medication is going to be heparin. And for the first one, we're going to give 5,000 units. So we check the dose, and then we're going to check the route and the frequency. And the second medication, we're going to be checking our morphine and the dose, 2 milligrams. And let's see here. Now, this does say IM, and our doctor's order says IVP, so I would check that with my doctor to make sure which one he wanted. I have checked with the doctor, and he said that was a mistake, and he thanked me for catching his mistake. But I corrected it, and I've printed out a correct MAR, so we will be giving it IVP and PRN as needed. He does not have any allergies, but we will double check that with him when we go to the room. Okay, and Dr. Know-It-All, which in this case I don't think he really knew it all, but okay, and so we are good. Now we're going to put our doctor's orders away, and we will keep our MAR. Okay, now we are going to get our medications out. I'm going to start with the heparin so that I can get to someone to verify that one with me. So I'm going to go to my drawer here. Heparin, 5,000 units. Okay, and I found heparin, 5,000 units. Okay, so we are good. We're going to just go ahead and do this one first. Let me verify it one more time. Do our second check. Heparin, 5,000 units. Now this is 5,000 units per ml. Since we were prescribed 5,000 units, we'll be taking 1 ml of heparin. Okay, we'll keep that out. So, let me see. We've done our second check on here. Okay, now take a look at the medication, check the expiration date, make sure the bottle is not cracked, make sure there is nothing else in any particulates in there. We are good with that. Now I'm going going to select my syringe. We're going to go with the tuberculin syringe. The reason that I'm going to choose that one is because with heparin, it is a high alert medication, and I want to make sure that I have the exact amount that we need. With this one, it already has a needle attached, so I do not need a drawing needle. First of all, I'm going to take my white and cleanse the top of that really good. Okay, I'm going to open my syringe. Okay. Going to, we need 1 ml, so I'm going to pull back 1 ml. So I need to put that air in there. I'm going to remove my cap. Place it right here because I will need to recap it so that we can go into the patient's room. And I would have already washed my hands before I started all of this. Inject the air in there. Okay. Now I'm going to pull back 1 ml. Air out. Just a touch more. Okay, there we are at 1 ml of heparin. To pull that back out, we will take this with us to scan. Going to do my one-handed scoop recapping method, which is going to be hard here. Okay, I'm going to, before I label the medication, I want to take it to my second nurse. Hi, second nurse. Here is what I drew up, and here is how much I have. So could you please tell me what I have? You have 5,000 units, 1 ml of heparin. Okay, great, we are good to go. So put that there. I'm going to label my syringe. I'm going to label it with a patient identifier, the medication, and the dosage. Okay. This one is ready to go. My second medication that I'm going to be giving is through an IV push. With the morphine, I do need to dilute it, and I will need to give it at a slower rate, and I am going to use, first of all, let me get my medication out. Pull out my morphine. Morphine, 2 milligrams. Yes, morphine, 2 milligrams. Okay. For my second check, morphine, 2 milligrams per milliliter. Okay, morphine, 2. Okay, that was my second check. Okay, now I'm going to check the expiration date, which we are good. Going to examine the medication, make sure the vial is okay, there's nothing in there, no particulates. Okay, so now we have the correct medication. Now, since we do have to dilute this one, I am going to, I will need a flush for administration, but I'm going to take the normal saline flush and I'm going to discard waste 1 milliliter so I can draw up. So we're going to go to 9 milliliters. Okay. So we'll waste that. I'm going to go ahead and put the top back on here. Now I am going to find a drawing needle. I'm going to take the 16 gauge draw up my morphine. I'll draw 1 ml. Clean the top. I'm going to make sure my bevel is in the medication. I'm going to draw up to 10 milliliters. So that will be 9 milliliters of flush in 1 milliliter of the morphine. I will take this to the room with me. I'm going to recap. Going to leave this on here because we need to go to the patient's room and I do not want that exposed. But I am going to label this medication, the patient identifier, the medication, and the dosage. And we have our flush, we have our medications, we have our gloves, our wipes, and our MAR. Okay, now let's go to the patient's room. Hi, Mr. Jones. I'm Suzanne. I'm your student nurse. I have your medications. Right here. Okay, I'm going to wash my hands. Provide privacy. Mr. Jones, can I get you to tell me your first and last name and your date of birth? Okay, great. Okay, now I have a couple of medications for you. The first one that we have that we are going to go ahead and do is going to be your heparin. I have already checked your labs and you are okay to receive it. We've checked your INR and your platelets and your PTT. I also checked to see in what location you had this medication last, and it said that it was in your left quadrant. Okay, we're going to go ahead and do it here in the abdomen, so we're going to go in your right quadrant this time. We're going to go 2 inches from the umbilicus. Okay. All right. Now with this medication, what I need you to look out for is any signs of bleeding or bruising. If your gums start to bleed, or you have a nosebleed, or you experience any blood in your urine, or any really dark, tarry stools that may have some blood in there as well, then I just need you to let me know. Do you have any allergies that you know of to any medications? No. Do you have any allergies to beef or pork? No. Okay, great. Okay, let me just go ahead and take a look here.
Check for any corn allergies.
Okay, all right, so the umbilicus, we're going to go about 2 inches out in the right quadrant. Okay, all right, let me go ahead and get my gloves on. While I'm getting my gloves on, I am going to perform my third check on the medication. The first one that we are going to be administering is heparin, 5,000 units, 1 ml. Heparin, 5,000 units, 1 ml. Okay, so we are good there. You doing okay? All right. Okay, take my wipe. Scan my medication. And we did our third check. Okay. Okay, so we are going to take our heparin. Going to cleanse in a circular pattern, going outward. And throw that away. Going to let that dry. I'm not going to blow on it or fan it. All right. Going to remove the cap. Going to find the bevel. So I want to make sure the bevel is up. Okay. We're going to go in, I'm going to pinch up, and we're going to go in at a 45-degree angle. Okay. I'm going to stabilize my needle. I'm going to push this at a slow rate. Not too fast, but not too slow, so the patient's sitting here forever with a needle in them. You doing okay? All right, almost done. Okay. I'm going to remove it at the same angle. It's squirting back at me. Okay, we're going to put this directly into Sharp's container. Okay. I would not aspirate with this medication. I would not massage. Okay. All right. Now you remember what I said about that bruising and bleeding, right? Okay. Let us know immediately. Okay. Now, the second medication that we have is morphine. What is your pain level right now? Okay, 8 out of 10. Okay. So 0 to 10, with the 10 being the worst, you're at an 8. Okay? All right. Now I'm going to assess this IV site for any signs of infiltration, phlebitis. There's no swelling, no erythema. Don't feel any warmth. Okay. All right. I'm going to check the morphine one more time. My pre-check. Okay. All right. Scan this medication. Okay. Let me go ahead and get my first flush ready. Take my wipe. Okay, I'm going to unclamp INT. Go ahead and clean that off. Going to be giving 5 milliliters of flush. Okay, go ahead and put my cap back on. Okay, now we're going to be doing our morphine. Now, Mr. Jones, it's very important that with this medication, you let me know if you're having any breathing problems or anything like that. Now, if you try to get up and get out of bed, you need to be very cautious. You can call me for help if you need to. Your wife can call us if she sees any problems, and ma'am, if you see him having any problems breathing, if he's excessively sleepy or if he becomes unresponsive or anything, then please let us know immediately, okay? And now you do not have any allergies to morphine. Okay, all right, great. I'm going to discard this in the Sharp's container. Going to take some wipe. Going to attach. Now this medication, we need to give it over 5 minutes. We have 10 mLs that we are giving, so we would be giving 2 mLs per minute, so every 15 seconds we're going to be doing a half a milliliter. And I would have my watch, watching, talking to the patient to make sure he's okay. One of the reasons that we dilute the medication is so that the patient does not get all of the medication rapidly and experience rapid onset of the central nervous system depressant. So we want to just introduce it slowly. Okay, we're doing this over 5 minutes. Okay. All right. 4 minutes. Okay. flush. Put that in a sharps container. We're gonna save it for today's purposes. Then we're gonna give our other 5 milliliters flush. We're gonna give this at the same rate. So we were doing a 1/2 milliliter every 15 seconds. Open that back up. So we want to give this the same so that what is in the line will go into vein at the same rate. So we will be watching every 15 seconds, 1/2 milliliter. Doing this in 2.5 minutes. Okay. All right. Good. Flushed, and we're going to clamp off. Okay. All right. How are you feeling? You doing okay? Okay. I would also discard this flush. All right. Now, patients in the lowest position, side rails up ×2. Call light is within reach. I'm going to dispose of my biohazards in the trash. Okay, now I'll be back to check on you in a few minutes to see how that morphine is helping your pain, okay? Do you have any questions? No? Okay, great. So now I'm going to take my medications back to the medication cart so that I can lock those up. Okay, and I would document the location that I gave the subcutaneous injection in, the medication, the amount, how the patient tolerated it. I would also notate on the morphine the patient's pain level prior to the administration, where that was, or the location was IV. And I will probably go back in about 15 minutes and reassess his pain level, and that will be documented as well. I will put my medication back. And make sure again, heparin, make sure I'm putting it in the right place. And the morphine. I've washed my hands before I left the patient's room. And I would go ahead and sign my MARA. I would document how the patient tolerated, if there were any abnormalities.